So now come to the infratemporal fossa. Infratemporal fossa, it is a fossa which is present below the temporal fossa. This is the temporal fossa. So infratemporal fossa is present below the temporal fossa. So this is the region of infratemporal fossa. So it is a irregular shaped fossa which is present behind the maxilla, and it communicates above with the temporal fossa through the gap between the zygomatic arch and the lateral side of the skull. So what is the boundary? So it has a roof, it has anterior wall, posterior wall, lateral wall, medial wall and floor. So the roof is formed by, in lateral part it is open. So this is the roof of infratemporal fossa, because this is the region of infratemporal fossa. So roof in lateral part is open and communicate with the temporal fossa through the gap between the zygomatic arch and the lateral side of the skull. In the medial part, the roof is formed by the infratemporal surface of the greater wing of sphenoid. So this is the greater wing of sphenoid, and along with this also roof is contributed by the corresponding squamous part of the temporal bone. So this is the roof, this is the roof, this portion is the roof. In the lateral part it is open, and in medial part it is formed by the infratemporal surface of the greater wing of sphenoid and adjoining squamous part of the temporal bone. The anterior wall is formed by the posterior surface of the maxilla. So anterior wall is formed by the posterior surface of the maxilla. So the junction in between the posterior surface of maxilla and the sphenoid, this portion, there is presence of fissure. This is known as infraorbital fissure, and through this fissure it communicates with the orbital cavity. So you could see here, this one is the infraorbital fissure. This is the infraorbital fissure. This one is the infraorbital fissure. Through this is the maxilla and the sphenoid is forming a fissure, which is the infraorbital fissure, and through this fissure it communicates with the orbital cavity. So this one is the roof, this one is the anterior wall. The floor is deficient. And the posterior wall is also open. So floor and the posterior wall is open. Now come to the medial wall. Medial wall is formed by the lateral pterygoid plate. This is the lateral pterygoid plate, and here will be the medial pterygoid plate. So the medial boundary of infratemporal fossa is formed by the lateral pterygoid plate. In between the maxilla and lateral pterygoid plate, there is a presence of fissure. This is known as pterygomandibular pterygomaxillary fissure, and through this fissure the infratemporal fossa communicates with the pterygopalatine fossa. So this is the pterygomaxillary fissure. Now come to the lateral boundary. So lateral boundary is formed by the ramus and the coronoid process of the mandible. So this is the ramus of mandible. It is forming the lateral boundary along with the coronoid process, inner surface of the coronoid process of mandible. This is this part. This part is forming the lateral boundary, and this is the region of infratemporal fossa. So if you see the roof of the infratemporal fossa, which is formed by the infratemporal surface of the greater wing of sphenoid and adjoining surface of the temporal bone, the roof represents two openings. One opening is here. This is one opening. This one is the one opening. This is known as foramen ovale, and here is the another opening. This is known as foramen spinosum. So what structure passes through the foramen ovale? 4 structure is passing, that is the mandibular nerve, accessory meningeal artery, lesser petrosal nerve and emissary vein. And through the foramen spinosum, what is passing? Through it passing the middle meningeal artery, and along with this nervus spinosus and posterior division of middle meningeal sinus. So basically through foramen spinosum, middle meningeal artery is passing, and through the foramen ovale 4 structure is passing, that is the mandibular nerve, accessory meningeal artery, lesser petrosal nerve and emissary vein. So what is the communication of this fossa? Above, the infratemporal fossa communicates with the temporal fossa through the pterygomaxillary fissure, through this fissure. This is the pterygomaxillary fissure, this one, through the pterygomaxillary fissure, which is between the sphenoid and the lateral plate of pterygoid and the posterior surface of maxilla. Through pterygomaxillary fissure it communicates with the pterygopalatine fossa, and through the gap between the sphenoid and the posterior surface of maxilla it communicates with orbital fossa through infraorbital fissure. This is the fissure. So these are the communication. Now come to the content. What is the content of infratemporal fossa? So it includes, one muscle is attached here, temporalis muscle. So the lower part of temporalis muscle, lateral and the medial pterygoid muscle, which is attached to the lateral pterygoid plate. Along with it contain the mandibular nerve and its branches, maxillary nerve and cauda tympani nerve, and also otic ganglion and its connection. Along with this, one artery is present, that is the maxillary artery and its branches. The venous plexus present here is the pterygoid venous plexus. So these are the content of infratemporal fossa.